Hi folks, my name is Jake Kurtis. I am the chair of the Department of Pathology and Laboratory Medicine, and I am the Stanley M. Aronson Professor. First, and obviously, the most visible has been the role Brown has had on the front lines, particularly Brown's faculty in the medical school. So if you look at the majority of providers in the state, they're actually in one or another of the Brown Medical School's departments. And these are key players, things like emergency medicine, the ICU care that you hear about, the infectious disease physicians, the stroke and coagulation physicians, the anesthesiologists, the nurses, it's been a terrific response. If you look at the burden of disease, it's been tremendous. I think our affiliated hospitals have done a superb job in responding to this crisis, and it's been really on the backs of incredibly dedicated healthcare workers. If you step back and look at the role of testing, I think again, Brown faculty have had a tremendous impact. Per capita, Rhode Island leads the nation in testing being performed on a per capita basis. And that really has been due to the foresight and hard work of folks dominantly in the Department of Pathology and Medicine, but across other departments as well. The third bucket I'd look at is sort of more of a long-term bucket, and that's the bucket of research. And here we've seen phenomenal partnerships between, for instance, the Department of Health and the folks in the School of Public Health and the biostats and epidemiology folks collaborating in order to have really well-designed randomized testing. So we need to understand this epidemic. We need to understand not just, the folks that are symptomatic are the tip of the iceberg. It's really important to understand where the asymptomatic cases are. And so Brown researchers have been critical in contributing to the design of those studies. We need the scientists and we need the physicians, but I think this pandemic really puts a spotlight on the need for the folks in the middle, the physician scientists, the MD PhDs, and the importance of the MD PhD training programs. If we didn't have those training programs 15 years ago, you wouldn't have those physician scientists on the front lines, taking care of patients, making clinical observations that drive scientific inquiry. Having individuals who are capable of speaking to the master clinicians, speaking to the hardcore basic scientists, and yoking together their skill set to solve the problems that these new diseases place in front of us. I think the notion of having a highly trained research arm to our medical profession has been brought into sharp focus. Who are we turning to for answers right now? We're turning to physicians and physician scientists and scientists that are on the front lines or one step behind them. I've been really impressed with how university-based scientists have dropped what they were otherwise devoting their careers to bring their knowledge to bear on COVID. That's been fantastic. We need to understand key aspects of viral biology. So the idea that we would not want to maintain a strong base in pandemic response, emergent viral infections or emergent infections in general, I think the need for those investments in the interregium between peaks and pandemics has now had its strongest evidence to date.